I'm Omodara Mills. Welcome to Inside Health. It's a video series where we explore various departments, units, and the services of the Tobago Regional Health Authority, the TRHA, to see how they operate to provide healthcare to you, our people. In this episode, we're taking a look at the Operations Department, Mechanical Engineering. Yes, I am aware it's not one of the frontline departments like accident and emergency or even the outpatient department, but it's still important in ensuring the optimal functioning of the hospital. So let's go see what this department is all about. In the Operations Department building right now, and here with me is Mr. Dwight Pierre, Mechanical Engineer. Mr. Pierre, we just want to find out a bit more about this Operations Department, what it is responsible for.
Okay, so I'm in charge of the Operations Department Mechanical Engineering Division, and we're responsible for all the mechanical maintenance of all the equipment inside the hospital. So anything from doors to incinerators, from elevators to washers, from dryers to boilers, those belong to us, and we're responsible for making sure that those things work properly. Everything in a hospital is supposed to perform zero fail. Anytime a piece of equipment goes down, that means some kind of inconvenience to a patient or to one of the medical staff. That could have very, very far-reaching consequences. So you have to make sure that all the equipment is running optimally at all times. I have 12 employees right now, spread out through the 2 incinerators and also at the laundry, and located at the new Scarborough Hospital, doing their checks and doing any repairs that may become necessary.
Tell us about this proactive approach in ensuring that all the systems work as they should.
Okay, so preventive maintenance is critical to making sure that your equipment works the way it should. In a nutshell, it says that instead of waiting for the equipment to fail unexpectedly, we will make an intervention at a predetermined time to restore the machine back to its original state, or a state very close to its original state. What happens here, what this causes us to be able to do is to save money. It also saves aggravation on the part of the patient or the customers in general, because the equipment is running when they need it to run. We are not in a firefighting mode where equipment is failing on its own and then we have to play catch up and try to repair this piece of equipment very quickly. We can take the piece of equipment out of service in a scheduled manner and get the repairs or the upgrades done as necessary. This being a hospital, there are a lot of redundant systems in place. So we have 3 fire water systems, we have 3 portable water systems. So this lends to the reliability of the equipment at the hospital and makes the preventive maintenance on the equipment that much more efficient.
We are in the incinerator room now. Tell us what this process is all about. What is the kind of incinerator at our hospital?
Thank you, Dara. Well, the hospital operates 2 incinerators right now. We have the CP30, which is behind us, and we have the CP50, which is at a second location.
You mentioned there are 2 incinerators. Tell us the importance or the benefits of having 2 on the island.
Well, having 2 incinerators, it provides us a certain amount of redundancy. So if God forbid this incinerator were to fail, we have a backup incinerator that we can use to remove the hospital's waste, and we don't end up with a backlog of waste. It also helps with the maintenance process. So if we stop this one for maintenance, we have another piece of equipment that we could use in the meantime. All biomedical waste goes to the incinerator. So results from operations, regular biomedical waste from changing patients or from dressing patient wounds, those types of things would come to be incinerated. The process of incineration is actually burning the waste. So there are 2 combustion chambers, each with its own burner. The first combustion chamber goes up to about 800 degrees. And this is where the burning of the waste actually happens. The second combustion chamber goes up to 1200 degrees. And what this does is further destroy the byproducts of the first burning that took place in the first combustion chamber. The gases that are produced from that move down the stack through a scrubber where the heavy particles of ash are washed out and then exhausted to the atmosphere. The ash that's taken out of the exhaust gas is taken to our waste treatment center, and that's where the water is purified and is discharged to the environment. The ash from the burning process is now denatured and indistinguishable from regular municipal waste, and that is taken to the landfill. Because of the concern that the residents have about the odor and the smoke that comes from the incineration process, we've given them the commitment that we were going to stop using this machine. So this machine is only being used for this interview only. All biomedical waste that would normally be incinerated here is being incinerated at the old Scarborough Hospital for the time being until we get the new sterile wave machine installed. This machine is a microwave sterilizer. What happens is that the waste is taken off the wards, is put into bins. The bins are then fed into the machine via an autoloader. The machine then shreds the waste and sterilizes it using microwave technology. The resulting waste is indistinguishable from municipal waste. It is sterile and it's safe to go to the landfill. There is no gaseous effluent. There is no liquid effluent that's produced. So this machine really is miles apart from the incineration process that we were speaking about previously.
Okay, and now people will be concerned it's in a box. So why are we showing it? Because it hasn't been installed as yet. But tell us about the TRHA's intent or the operation department's intent to have it installed as soon as possible.
Yes, well, we do have intent to have it installed as soon as possible. The COVID-19 pandemic has delayed us somewhat, so there's some pieces of equipment that have been delayed. Also, the technicians for the commissioning and the installation are unable to travel at this time. So the machine is here, we are ready to go, and as soon as we are allowed, we're going to be ready to install the machine.
Okay, so that means there'll be no more emitting of the gases that will affect residents or anything like that?
No, this is miles away from that. We've heard their concerns, and this machine takes away and eliminates all those concerns.
A major part of the operations department is ensuring that medical supplies are at the hospital as well as the health centers. We have here the patient's material and transport supervisor, Mr. Osbert Wilson. He's going to give us an idea of his part in this part of the process.
My core duties as a patient materials transport supervisor is to ensure that we have reliable and adequate supplies of medical supplies to all health facilities throughout the island. I am responsible for also procuring and transporting medical supplies from Trinidad, mainly C40 or central NIBDEC central stores, which are the main aspect of supplies to our hospitals. So we have transport that goes to Trinidad on a regular basis, collect these items from C40 and transport it to the hospital. Then we do our disperse to the health facilities on the island. I am responsible for logistics, also assist with palliative care, patients, non-emergencies, ambulance service from the health centers to the hospital, discharge patients from the hospital to their homes, and also medical gas. This is a critical aspect of the hospital medical supply. So all medical gas I'm responsible for, and we also assist home patients with that service also. The operations of the laundry, I play a key role in that also, in terms of transporting the soiled linens from the hospital to the laundry, and also transporting clean laundry to the hospital and all the medical facilities on the island.
Do you like what you do? Tell us why, and how do you see it playing an important role in providing quality health care for those medical staff as well as the patients?
Okay, now the operations at the hospital here, each service goes hand in hand. So if I fail in my aspect, then it is going to affect the other operations. So my role in terms of these operations is critical. If we fall short, then everything that goes with that service will also collapse. These here are what you call non-sterile gauze. These gauze play an integral part in our process for surgery and also dressings. these gauze, as it is marked non-sterile, it goes through a process of being sterilized at the CSSD department, placed in emergency packs, dressing packs. Emergency packs is for the operating theater, and also dressings for persons who have ulcers and so on at the district community health centers, which is wound care. So it goes to wound care and do the process for dressings and so on. This also will be, as you say, it's shipped this morning. We received it, and it is in the process now to go into stores to be placed on our bin cards.
Mr. James, you were talking about the importance of your department in ensuring the health of the patients who come to the hospital or who would use the equipment at the health centers. Tell us about this.
All right, so basically we're sterilizing the gauze and, basically everything that leaves in the department supposed to be sterilized, which are our best to sterilize everything as best as we can for patient care wise, and basically to stop the spread of infection.
We also toured the utility rooms. This area houses the boiler room, which supplies amenities such as air conditioning, hot water, steam for sterilizing equipment, backup electricity, concentrated oxygen, and soft water. There's also the control room where workers monitor the processes and the systems throughout the Scarborough General Hospital.
We are the support for the hospital and the custodians for most of the equipment in the hospital. Without us, they will get no water, no electricity, no oxygen, nothing. We are like the blood. The BMS system controls the lighting, the air condition, the comfort for everyone and things. So certain parts of the hospital will, when people not around, like admin and thing, it will shut off the AC and thing in that section, saving the hospital a lot of money from having to spend. It also controls the lighting, and it's for your comfort and also to save energy.
We actually produce our own oxygen in Tobago for our patients. As you know, oxygen is a critical part of our healthcare delivery, so we ensure that we always, at all times, have oxygen on the island.
So we are here with Mr. Mervyn Collins, a mechanical technician at the laundry. Mr. Collins, give us an idea of what are your responsibilities at the laundry here?
Actually, my responsibilities at the laundry is to take care and responsible for the equipment at the laundry, to maintain them and run them on a daily basis. We have equipment such as folders, feeders, ironers, and dryers and washers. So on a daily basis, I have to make sure that all these equipments are up and running for the workers to carry out their duties.
When someone has to go to a hospital, you're already meeting them on one of their worst days. No one likes to come to an hospital for anything. So what we do, our backline and frontline systems helps make that experience a lot less traumatic. You're already here on a bad day. You don't have the added aggravation of air conditioning systems not working, lights not working, doors failing. The equipment is running, so you can access the service that you came for in a timely manner, in an efficient manner. And that's where my department really fits into the whole scheme of making sure that patients and the medical staff really can do their jobs efficiently.
There you have it, viewers. We've learned that a lot goes on in the operations department, like oversight of the hospital's vehicles, ensuring a constant supply of concentrated oxygen to patients who need it, providing a safe way for biomedical waste material to be removed from the hospital via the incinerator, and 24/7 monitoring of the hospital's utilities. It's all meant to ensure a smooth flow of the healthcare amenities at the hospital. That's it for now. Thanks for watching Inside Health. Until next time, we do hope that you make your health a priority.